As you know by now, it is NASCAR weekend here in Chicago. The races and the air quality issues this week have emergency rooms on alert.
Joining us now live is Dr. Nicholas Cozy, the Assistant EMS Director and a professor at Rush University Medical Center. Doctor, thanks for being with us.
Thank you for the opportunity. How are you, Ben Lawrence?
Good. First of all, let's talk about sound, because for people who kind of live down near Grant Park, it's going to be a change for them. How do you protect your ears if you're out and about checking things out, or if you're a spectator?
It's a great question. Ear protection is key. Earplugs are essential, whether you're a spectator or you're in the loop region. You want to be making sure you're protecting your ears. Elderly, above 65, or if you're a child, you want to make sure that you're wearing earplugs or even having more protection in terms of earmuffs.
Okay, so if you are downtown and maybe you haven't taken these precautions, what are some signs or symptoms or things that you should watch out for that may be a tell to say, hey, I need to go into the emergency room or I need to go into the hospital because I'm having some hearing issues?
It's a great question. If the sound sounds muffled or you're having ringing in your ears or intense pain in your ears, those are signs and symptoms that you should seek medical attention immediately.
Now, we've been reporting on air quality issues all week long. How should people know whether or not it's affecting them, whether or not they actually have to stay indoors?
Well, if you have asthma or you have COPD or chronic obstructive pulmonary disease, if you're a smoker, the air quality is poor. It's getting better. However, you will be more likely to have symptoms of shortness of breath, cough, difficulty breathing. You'll likely be using your inhaler more. Those are signs and symptoms that you should be on the lookout for.
All right, all good things to watch for. I do want to ask you about, how hospitals and emergency rooms throughout the city really prepare for such a large event like this. Not only do you have, intense racing going on the streets, but you've got thousands and thousands of people that are coming downtown who may have medical emergencies.
It's an essential question. I think the Chicago Department of Public Health does a great job coordinating all of the hospitals within the region. The EMS system does a great job as well. And those are things here at Rush we're doing to make sure we're prepared should patients arrive to our doorstep.
And doctor, do you usually see an uptick in patients when you have these big events, something like Taylor Swift concerts or other things where people tend to get a little overexcited?
Well, I don't think patients at the Taylor Swift concert want to leave that concert given
Yeah.
tickets are. But, we do see an uptick every now and again for certain special events, but the city does a great job making sure we're being very intentional on who we transport or who the city transports to different hospitals. And it's great coordination, a lot of players, a lot of key stakeholders, and we're looking forward to having a good weekend here at Rush.
Okay, sounds good. So again, the key pieces of advice, you watch the air quality and of course be cognizant of the noise pollution that might come from those NASCAR races this weekend.
Absolutely. Be on the lookout. If you're starting to develop symptoms, go inside. And thank you. We're looking forward to a great race.
Okay, thank you, Dr. Nicholas Cozy.
Thank you. We appreciate your time.